Welcome to this explainer. We've all daydreamed about our perfect forever home, right? But how often do we actually stop to think if that exact same home will support us when we're, say, 85 years old? Today, we're diving into exactly how we can transform standard homes into genuinely safe havens for aging individuals. We're going to look closely at the data-driven architectural and ergonomic guidelines to figure out how our living spaces literally need to adapt as our bodies change. And trust me, this isn't just about slapping a few handles on a wall. It's about fundamentally rethinking home design so we can all safely age in place. So let's kick things off with a pretty tough question. Is your bathroom secretly threatening your independence? Take a second to think about your own bathroom. For most of us, it's just a place of daily routine. But for the elderly, the wet bathroom, or baño, is statistically the absolute highest risk area for falls in the entire home. Just a simple slip while trying to wash your hair or step out of the shower can suddenly and permanently end someone's ability to live on their own.
Here's our roadmap for today. 1. The risk to independence. 2. Lighting for aging eyes. 3. Safe and ergonomic washing. And 4. Crucial bathroom safety features. Let's get right into it.
Section 1. The risk to independence. Hidden hazards at home.
Look, as we age, we're all going to face a trifecta of challenges: mobility limitations, visual disturbances, and just general fragility. What this means in practice is that a basic, routine task like personal hygiene, standing under a shower to wash your hair, or leaning over a sink suddenly turns the standard bathroom into something resembling an extreme sports arena for aging joints. Fatigue sets in way faster, muscles are stiffer, and those wet, slippery surfaces become a very real threat when your center of gravity and reaction times just aren't quite what they used to be. This research quote really hits the nail on the head. The true danger of a fall isn't just the physical injury, right? It deeply, profoundly impacts an elderly person's life satisfaction. A severe fall often forces a sudden, completely unwanted transition from an active, independent life at home straight into long-term dependency or assisted care. So the whole goal of ergonomic design is to preserve that independence and dignity for as long as humanly possible.
Moving on to Section 2. Lighting for aging eyes. Seeing the space clearly.
Now here is the absolutely fascinating science behind this. As we age, the clear fluid in our eyes physically changes. It actually turns yellow. This condition is known as crystalline lens yellowing, and it acts exactly like a permanent yellow filter placed over your vision. The result? It drastically reduces your contrast perception. It makes it incredibly difficult to see edges, steps, or, and this is the scary part, clear, wet spots on a light-colored bathroom floor. To combat this declining vision, ergonomic guidelines don't mess around. They're very specific. They suggest providing at least 50% more illumination than standard levels in task areas like the bathroom and the kitchen. We're talking about aiming for 300 to 500 lux of light. Just to put that into perspective, that is significantly brighter than a standard hallway, and it's absolutely crucial for providing the visual comfort and safety needed to navigate these high-risk spaces.
But hold on, you can't just blast a room with a harsh spotlight. Doing that creates glare, and aging eyes are incredibly sensitive to glare. Instead, we have to replace standard overhead lighting with well-distributed, glare-free light. And we need to pair that light with high-contrast floor and wall colors. We're specifically talking about using matte finishes here, definitely not polished or slippery ones, to help aging eyes actually navigate the room without confusion or visual fatigue.
Section 3. Safe and ergonomic washing. A secure daily routine. Taking a look at these ministry guidelines, safety basically dictates specific architectural clearances around our bathroom fixtures. You absolutely need at least a 90-centimeter clear width to accommodate someone using a walker or a wheelchair. This makes sure they actually have the maneuvering space to comfortably approach the sink, shower, or toilet without getting trapped, bumping into sharp corners, or having to twist their body in a weird way, which, as we know, can easily trigger a loss of balance. Think about a standard bathroom sink, or lavabo. It's usually about 85 centimeters high, usually with closed cabinets underneath, which pretty much forces you to stand. An accessible sink, however, is a game changer. It's lowered to an ergonomic 70 to 75 centimeters high and features a mandatory 20.5 centimeter knee clearance right below it. This specific modification is designed for someone who really needs to sit down while washing their face or while performing the honestly exhausting task of washing their hair. It goes a long way in helping manage joint stiffness and fatigue. So this ergonomic seated washing routine breaks down into 3 crucial steps. First, the user scoots their chair under the sink, taking full advantage of that vital knee clearance. Second, they wash comfortably at that lowered 70 to 75 centimeter height without having to hunch over. And third, they operate single-lever faucets. Look, when you're washing your hair, your hands are soapy, and aging naturally brings reduced grip strength. Complex, twisty knobs? No way, they're out. A simple single-lever faucet or shower control that you can push with the palm of your hand or even a forearm is an absolute must for independent use.
Okay, moving to our final section, number 4. Crucial bathroom safety features, preventing falls.
The transition into the shower, it needs to be entirely step-free, literally flush with the rest of the bathroom. Think about it. Stepping over even a tiny threshold when your feet are wet, the floor is slick, and your balance is already a bit compromised, that's just a recipe for disaster. By eliminating that threshold completely and putting in proper drainage, you remove a massive tripping hazard, creating a perfectly seamless and safe walking surface.
Now, for stability inside that shower, the precise placement of easy-to-grip grab bars is critical. They have to be mounted securely at a very specific height of exactly 90 to 100 centimeters from the floor. Why that exact height? Well, because it perfectly aligns with the natural reach of an elderly person trying to catch or maintain their balance. Whether they're standing to wash or safely transferring their weight down onto a shower seat, it's right where their hands naturally go.
If you take away anything from this explainer today, let it be this checklist right here. Caregivers and designers, you should absolutely use this to audit your spaces. You need non-slip flooring or mats that actually work, even when they're soaking wet. Doors, they must open outward, because if someone falls inside against an inward opening door, you literally can't get in to help them. And definitely don't forget the emergency call cords. You want one at 110 centimeters for standing reach, and crucially, one just 10 centimeters off the floor, so it can still be pulled even if someone has already fallen to the ground.
Now, while walk-in showers are almost always preferred, we know sometimes a bathtub is unavoidable. But if a tub is absolutely necessary, it requires some serious modification to be safe. It must have a maximum step-over height of just 45 to 50 centimeters so we can prevent overexertion. On top of that, it has got to be equipped with securely mounted seats inside and multiple vertical grab bars on the walls to physically help the user safely transfer their weight in and out of the tub without slipping.
So, we're wrapping up this explainer by asking you to really reflect on these principles. Ask yourself, how are you designing your home today for your future self? Because aging in place isn't just about stubbornly staying in a house. It's about making sure that house actually supports your life. By implementing these ergonomic changes, from those 70-centimeter seated wash basins to the glare-free lighting, you are actively creating a secure, accessible environment. And at the end of the day, that is the ultimate key to preserving independence, dignity, and life satisfaction in our later years. What changes will you make first?